Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the conducting system of the heart. The conducting system of the heart is carried out by specialized cardiac muscles. They are essential to coordinate cardiac cycle and to initiate impulse and propagate rapidly through the heart. So, the conducting system of the heart is formed by modified cardiac muscles. The components of conducting system of the heart are the components are sinoatrial node, sinoatrial or SA node, AV node or atrioventricular node, atrioventricular or AV node, AV bundle or atrioventricular bundle, left and right branch of the AV bundle, left and right branch of AV bundle. AV means atrioventricular bundle. Okay. Then we have the Purkinje fibers. So these are the components of the conducting system of the heart, the SA node or sinoatrial node, SA node or sinoatrial node, atrioventricular node or AV node, AV bundle, left and right branch of AV bundle, and the Purkinje fibers. Now we'll go to find out the location of each of them. Okay. First of all, to identify here, this is the SA node, this is the AV node, number 2, number 3, this is the AV bundle, then left and right branch, this is the one branch, this is the right branch, there is the left branch. Okay. Then we have the Purkinje fibers on the right ventricle, Purkinje fibers on the left ventricle. So these are the components of the conducting system of the heart: SA node, AV bundle, then the branch of AV bundle, this is the right branch, and this is the left branch. Right branch partly goes through the moderator band or septum marginal trabeculae and partly goes directly along the interventricular septum to the right ventricle. Okay, we got the components of the conducting system of the heart. Remember that these are modified cardiac muscle. The purpose of this muscle is to generate impulse and to propagate the impulse throughout the heart. This is a one-way propagation of the impulse and its conduction. So we got the components. So first of all, we'll say about the SA node, where it is located. Okay, located in the upper surface of the right atrium above the sulcus terminalis at the junction, okay, just lateral, slightly lateral to the junction of the superior vena cava and the right atrium. So where it is? This is here. Okay. Its width is around 3 millimeter, length maybe around 17 millimeter, and its thickness is around 1 millimeter. So it is small, elliptical, modified cardiac muscle located at the junction between the superior vena cava. This is superior vena cava. This is right atrium, and it is located here. That is the sinoatrial node. What is its importance? This is the pacemaker of the heart. Okay, this is the pacemaker of the heart. We got the location of SA node. Then we'll go to the location of the AV node. So these are the modified muscle, and all of the conducting system of the heart are modified cardiac muscle. Then we'll go to the AV node. Where is the AV node or atrioventricular node? It is also in the right atrium. Okay. Posterior inferior part of interatrial septum, in the triangle of Koch. Okay, the triangular Koch is bounded by ostium of coronary sinus, or opening of the coronary sinus, tendon of Todaro, and septal cusp of tricuspid valve. So it is located in a triangular area here, that is bounded by the opening of the coronary sinus. We call it opening or ostium, tendon of Todaro, septal cusp of tricuspid valve. They just above the endocardial cushion in case of developing heart. Okay, we got the AV node. AV node also can generate the impulse, but its rate is less than that of the SA node. SA node, if it is around 70 above, it is much less than that of the SA node. Okay, we got the AV node. Then we go to the AV bundle. AV means atrioventricular bundle. The AV bundle begins from the AV node. Okay. It begins from the AV node. It pierces the fibrous skeleton of the heart, This is connective tissue. It wires the heart to the posterior part of the, it goes to the posterior part of the membranous part of interventricular septum, membranous part of interventricular septum. Our interventricular septum has two parts. This is muscular part, this is the membranous part. Interventricular septum. Okay, we got that. And splits into left and right branch, and splits into left and right branch of the, into left and right branch of the AV bundle. Okay, so it pierces the fibers into the connective tissue, goes around the posterior aspect of the membranous part of interventricular septum, and at the top of the muscular part of interventricular septum, it splits into two. One is going towards right here, another going towards left as left bundle branch, right bundle branch. Okay, we got the AV bundle, we got AV node, we got SA node or sinoatrial node, sinoatrial node or sinoatrial node. Okay, we got that. Then the branch will give rise to the formation of Purkinje fibers. Purkinje fibers. These are present in the ventricles. Okay, they are present in the ventricle. Okay, in the wall of the ventricle, in the wall of the ventricle, Okay. Initially they are subendocardial, then intramyocardial. Okay. Initially subendocardial, then intramyocardial. Initially just underneath the endothelium, then it goes inside the muscle. Okay, these are the Purkinje fiber. They are present in the wall of the ventricle. Okay, we got the conducting system of the heart. Okay, components. We have to know that the AV bundle is the only connection of the atrial and ventricular muscles. Ventricular muscles. So this is the only one connection. Initially we developed from the primitive atrium, then by epicardial we'll get separation of the atria from the ventricle, but AV bundle is the only muscular communication between the atria and the ventricle. Okay, only muscular connection between the atria and ventricle, between the atria and the ventricle, Okay, we got that. So we got the location of the conducting system of the heart. Now we'll go to the blood supply. Blood supply of the conducting system of the heart. Okay, blood supply. The SA node, AV node, AV bundle, and also the right branch are getting blood supply. SA node, AV node, AV bundle. Okay, and right branch of AV bundle, AV bundle, getting blood supply from the right coronary artery, right coronary artery. There is a branch of the ascending aorta. For the left branch of AV bundle, this is, it gets its blood supply from the left coronary artery. Left coronary artery, especially by the left anterior descending branch, by anterior interventricular artery, its branch artery, by LAD, left anterior descending branch of the left coronary artery. We got the blood supply. So mostly blood supply is coming from the right coronary artery. Only this part is getting blood supply from the left coronary artery by the left anterior descending branch or anterior interventricular branch of the left coronary artery. We got the blood supply. How about nerve supply? Nerve supply. Okay, this tissue has the independence to generate impulse and to propagate impulse from SA node by means of the myogenic conduction to the AV node. Then it will continue in the bundle of His, of the AV bundle or bundle of His will have two splitting going to the heart wall. Okay, this is the way. But nerve supply can regulate the action of the conducting system of the heart. So sympathetic will stimulate heart, so increase heart rate, increases heart rate. It is called tachycardia. Okay, tachycardia. Parasympathetic, that is mostly vagus nerve. Parasympathetic. Okay, that will call decrease heart rate. Okay, we got the role of autonomic nervous system to regulate the impulse rate. Okay, by sympathetic increases heart rate, parasympathetic decreases heart rate. Okay, we got that, the nerve supply of that. Okay, now I'll go to the histology of the conducting system of the heart. Histology, again we have to say they are specialized, modified cardiac muscle. Okay, and everything. SA node, this is SA node, this is AV node, this is the bundle, AV bundle, this is the left branch of AV bundle. Okay, this is the Purkinje fiber in the left ventricle, Purkinje fiber. Here we have Purkinje fiber in the left ventricle. This is the right branch Okay, so these are modified cardiac muscle, and they have minimum myofibril, okay, than other regular cardiac muscle. Okay, you can say less myofibrils. Okay, cell size is also small. Cardiac muscle cell, they are modified cardiac muscle cell. Cell size is small. So that is the histological characteristic of the conducting system of the heart. Okay, we got that. And if we go to the AV node, this is the characteristic of SA node. AV node almost like that of SA node, small muscle, less myofibril. Okay, but this also has multiple cellular projections. Multiple, so it has small muscle. Okay, small muscle cell, less myofibril. Then we get multiple cellular processes. Okay, AV node. If you go to the AV bundle and branch, okay, and branches, we get large muscles. Okay, if you go to the Purkinje fiber, then we'll see that contains certainly less myofibrils like other conducting system of the heart. But here, most important point, plenty of mitochondria, because we need power to contract the ventricle, and also get perinuclear glycogen. Okay, we got the histology. We have to add one more point here. Histology almost same, everything is same here. Just one more point. We have to find out the moderator band here, or septomarginal trabeculae. Moderator band. What is that? Also called septomarginal trabeculae. Okay, same thing. Okay, so it contains some of the fibers of the right branch of AV bundle, from the lower part of the interventricular septum to the base of the anterior papillary muscle of the right ventricle. Okay, this is a muscular band in the right ventricle. From the lower part of the interventricular septum, to the base of the anterior papillary muscle of right ventricle. Okay, this is a shortcut for some of the fiber of the right branch to go to the anterior papillary muscle, anterior papillary muscle of the right ventricle, papillary muscle of right ventricle. We have three, okay, in right ventricle. So this is the connection. So some of the fiber, the right branch, go to the AV, to the anterior papillary muscle of the right ventricle for coordination and shortcut of the impulse. Okay, we got the moderator band or septomarginal trabeculae. Its importance: carries some fibers going to the anterior papillary muscle of the right ventricle for coordination and shortcut here. In lieu of going through that, going there, some fiber goes there, some fiber goes there. Almost half fiber goes there through the moderator band. Okay, we got the histology. Now we'll go to the embryology. Embryology. This is a modified cardiac muscle. So we have to know that the SA node and most of the AV node, SA node and most of the AV node is derived from, let's say, are derived from the sinus, from the sinus venosus during 5th week of intrauterine life. Okay, so that is the embryology. This is due to the incorporation of the sinus venosus to the right atrium. We will get the SA node and most of the part of the AV node. AV node also comes from the surrounding cardiac muscle. Okay, other muscle fiber derived directly from modification of the other muscle. Okay, this is got SA node, FA node, AV node. Okay, so other part are modification of cardiac muscles. This is also modification, but they are coming from the sinus venosus cardiac muscles. We got the embryology, we got the histology. Now we'll go to the clinical anatomy. Okay, we have to know one important point regarding the blood supply of the conducting system of the heart. Usually the right coronary artery has more role, but in some individual, left coronary artery may have more role. It may also supply the SA node or AV node. That is possible in small percentage of population. We'll go to the clinical anatomy. We have to know that SA node produces impulse. If there is no impulse, then we'll have bradycardia, heart rate will go down. Okay, so we may have bradycardia, one of the important point is here, and we may have heart block. We may have bradycardia or decreased heart rate, or we might have arrhythmia. Okay, these are the possible complications of the AV node. We have to know. Just before finishing, we have to add one more thing. In case of VSD or ventricular septal defect, the margin of the defect of the VSD contains the conducting system conducting system fibers. Okay, so surgeons should take care of that part. Okay, so to protect the fibers, if there is a ventricular septal defect here, then at the periphery we may have the fibers. So that's all about the anatomy of the conducting system of the heart. If you have any question, please feel free to ask me. Please share the information with your friends, and please subscribe my channel, support my channel. Please subscribe me. Have a nice day. Bye now.